You know, as a physiatrist, I believe in mobility, and I think it makes people healthier. And I think that our patients, our families, and all of us who provide care, we all know that mobility is a healthy thing. Why couldn't it be something that we add into the sick patient and allow them to turn into a healthy patient?
The goals would be to assess the patient's needs for mobility, to help get them in a category of services, and to screen every patient that comes to the floor, to deliver excellent quality of care by the whole interdisciplinary team in regards to mobility.
As a nurse, we work closely with the physical therapist and the patients. Sometimes after the initial screening, the physical therapist will determine that the patient is kind of cleared in a sense to work more with the nurses, so then it becomes our responsibility to get them out of bed and get them up and moving for the day rather than the physical therapist, so they can work with some of the more deconditioned patients who need a little bit more attention in that area.
The nurses got to learn so much from the physical therapist, just from help me get this patient out of bed, and they were able to spend that time with our physical therapist to say, yeah, this is the proper way to lift a patient. When you're motivated and you kind of want to work towards a common goal, I think more people are willing to push and be a little bit more collaborative with each other.
We've all been educated that evidence-based practice has showed that getting a patient up sooner than later has been a benefit to getting them back to health and getting them home.
We're so excited about how we're on the cutting edge of the mobility pilot and what that means to our patients, decreasing the length of stay, improving their quality of life upon discharge and their disposition at discharge. It's been an exciting journey, and it will continue to be as UPMC is on the forefront of mobilizing our patients.
We owe a great debt of gratitude to all of the participants, every therapist, all the the Center for Rehab Services, for the nursing units that participated with us, and to those patients and families who allowed us to iron out some of the wrinkles as we were putting together this mobility initiative. The results that we've had have been really, really strong, and it's supportive that we can only do better for patients by continuing this initiative.